Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
So, Steven, last week, Corey co-hosted with me, and we talked a lot about policy and advocacy for 2024, the usual stuff like step therapy and copay accumulators, but a big topic that came up was these Prescription Drug Advisory Boards, or PDABs for short, and we thought it would be good, you and me, to devote an episode to it after reflecting more on that.
Yeah, absolutely. This is a somewhat new phenomenon, these Prescription Drug Advisory Boards, and their overarching aim, if you will, is to take a look at prescription drugs generally at the state level and to impose some price controls over some of these drugs.
So maybe we could take a step back and talk about healthcare costs being high in general.
Yes.
Kaiser Family Foundation always puts out really good data on this, and I found some that was published on their site end of last year. So are you ready for this?
Yeah.
About half of U.S. adults say it's difficult to afford healthcare costs, and 1 in 4 say that they or a family member in their household had problems for paying for healthcare in the last 12 months.
Yeah, so 1 in 4 put off paying for healthcare in the past 12 months. Interesting. I presume it includes skipping or postponing getting healthcare that they needed because of the cost.
Yeah, that's right, Stephen. 1 in 4 adults said that they skipped, and that also can lead to higher costs later on because when you delay necessary care, like it could end up in a more devastating way and you could end up in the ER. And,
Yeah.
we always talk about preventative and early care is really important, obviously for your health, but also for keeping costs down.
Yeah, but I am just curious, when they do surveys on high costs, is there anything that people would respond to and say, no, those costs are not high? I feel like when asked, people will say, yeah, restaurants are expensive. Yeah, food costs are high. Yeah, car costs are high. Yeah, gasoline costs are high. Like, I'm just curious, like, when do people say that something is not expensive?
That's a good point. And my thought is like that there's some good data in here about what we just said, that they're skipping or postponing care, or like this next stat about 1 in 5 adults say they haven't filled a prescription. So yeah, I can complain that my healthcare is expensive, but me, Zoe, is still paying for it. I've never forgone care, fortunately, because of the price. But in here, it shows that people are actually forgoing the care. So I think
Right.
maybe that's like the nuance there, that we could say it's not just complaining.
Totally. And I apologize for sounding glib. There is a difference with healthcare and other items when it comes to cost. Healthcare is necessary, of course, or it directly affects your health and your ability to live your life. So there is a difference. I was more like poking fun, I guess, at the survey, if you will.
Yeah, like who's going to be like, I love the price of my drug.
Yeah, I know.
So yeah, about 1 in 5 adults said they've not filled a prescription because of costs.
Okay.
1 in 10 said they've cut pills in half or skipped doses of medicine in the last year because of cost.
I've done that. Not in the last year, but I've done that, yes.
Really?
Back in my younger days.
Steven, you gotta take it as your doctor prescribes. You can't be cutting pills.
Well, when I was in law school, finances were tight. What can I say? That's all I'll say about that, I guess.
And then all this is to say is that even if you have healthcare insurance, costs can still be a burden, right? So this isn't just like uninsured people that are paying ridiculous amounts. This is also people on health insurance. The last stat I have here is that about 4 in 10 insured adults worry about affording their monthly health insurance premium, and 48% worry about affording their deductible before their health insurance kicks in. That's a lot of stress,
Absolutely. It's very stressful, and not to put too fine a point on it, but when you have a chronic condition, I'm sure that gets even magnified even more because you're taking prescription drugs likely for life.
Yeah, chronic condition equals chronically paying.
Right. So that fear is, I would say, almost always omnipresent. Even if it abates a little bit here and there, and you're in a financial position to pay for something, or you have an insurance carrier that enables you to pay, there is always that fear of when that could get cut off at some point or costs can rise. So yeah, that is an ever-present concern.
So what do we do about it? In come these PDABs.
So PDABs. So prescription drug advisory boards were designed as a way to help lower drug prices at the state level. They are created through state legislation and are small boards appointed by the governor or legislators. The goal is to reduce government and commercial market spending on prescription drugs to increase affordability.
So, how do they do this? How can this group of appointed people just come in and lower the price of drugs?
Right. So what they do is they conduct what are called affordability reviews. They assess if a prescription drug cost is too high for patients and insurers to afford. And they try to understand what prices are being charged for certain treatments. And then they make recommendations to the legislature on ways to lower government spending on prescription drugs.
Okay, so I'm just wondering why now? Like, I know drug prices are high. We just went through the data, but
Right.
what kind of kickstarted these PDABs?
Why is 2024 the year of prescription drug advisory boards?
Yeah, it's like the night of Passover. I have the four questions.
Right.
Why now? How do they do it? What drugs? Let's break it all down.
Well, why now? I guess the overarching answer to that is that policymakers are always looking for ways to cut costs throughout the state, and they're particularly interested in cutting costs on prescription drugs. It's a very salient issue. It gets a lot of media attention, more so than cutting costs in other areas, perhaps. So it's something that's always top of mind, if you will, for state policymakers and federal policymakers, for that matter. Specifically in 2024, the interest on the state level, it really kicked off because of what happened at the federal level with the Inflation Reduction Act. And the Inflation Reduction Act included a provision, as you may recall, for federal drug price negotiations, Medicare drug price negotiations.
Oh, right. Yeah.
Yes,
Back in August, we talked about the first 10 drugs, right?
exactly. So in August, CMS announced the first 10 drugs that would be up for negotiation, and the prices will become effective in 2026. So that kind of kickstarted the idea to do something similar at the state level.
So, how do we know what drugs get reviewed? We just mentioned that CMS announced the 10 drugs. Was there some announcement among the states? How do we know what's going on?
Well, every state's different. I mean, it seems to be becoming fast and furious. There are 50 states, and it looks like already on the books, including in late 2023, at least a half a dozen that I could think of between November and this upcoming spring, with more probably coming on the way. In each state, it varies. Each board specifically varies how it selects the prescription drugs that they want to review. And if a board determines that a drug is unaffordable in their terms, it could take a variety of steps depending on their degree of authority granted to them by their state legislature, including making recommendations to the legislature on ways to lower drug spending. Potentially, they might have the power to negotiate how much a state pays a manufacturer for a prescription drug, or they could set what are called upper payment limits, which are caps on what a state will specifically spend on a prescription drug.
And do we know like how long this would take to go into effect? I know for federally, those first 10 drugs are going to happen in 2026. So it's like a little ways away. So I assume patients can't expect any price changes so quickly.
You know, at the state level, the laws could be different, the way that they're written by the legislature, and rules could be implemented in a much more rapid fashion than at this federal level.
Very cool. Okay, so we'll keep our patients updated as we see what these boards decide.
Yes, but I do want to highlight that these boards may not be the panacea that they appear to be.
Oh, tell us more.
Well, first and foremost, these boards are made up of individuals selected, as we said, by the legislature or the governor. They're not made up of patients, so they don't necessarily have the patient perspective in mind when discussing, how to formulate these drugs and the impact it's going to have on patients. They tend to be health economic professionals or other healthcare professionals. But that's why we do what we do, is to get involved and insert the patient voice where possible.
Exactly, because at the end of the day, these are decisions being made for patients that will impact patients who are taking these drugs. So we ought to have the patient perspective
Absolutely.
in these meetings in order to decide what is the right price for patients.
Exactly. First and foremost, if there are going to be savings, they need to go to the patient. If the patient's not going to see the savings, we want to ensure that a patient is not going to have a reduction in access to medications that they're taking. We were talking about costs earlier, and costs are a factor, but another factor is actual access to medications. You need to take take your drugs to stay healthy. And again, not to go back to this but when you have a chronic condition, it is absolutely critical to stay current with your medications.
For sure. And I even had just in the new year, like insurance can reset and things aren't like
Mm.
all lined up. And for my biologic, for like a day or two, I thought I was on the line for $5,000 and I was freaking out. I didn't have a supply in my fridge. I didn't want to miss my meds.
Oh,
There's
man.
no way I'm paying $5,000. I called the specialty pharmacy. They helped. They got the manufacturer copay assistance payment, and thank God for that. But
Wow.
it's scary out there with these meds, you know?
I know.
And I'm educated. I work in healthcare and I knew something was wrong.
Yeah.
And there's no way I'm going to be on the line for this. But there's so many people that just wouldn't know what to do in that scenario.
Healthcare is so intimidating. The thing I would say is, I think it is very natural to be intimidated when dealing with monetary situations in which you are somewhat of a novice or not an expert. And very few people are experts when it comes to healthcare. I'm very fortunate. I understand healthcare similar to you. This is what we do. It's not fun, but I know how to get my healthcare paid for and how to fight and how to call the insurance companies and be patient and press the right buttons on the phone and until I speak to the right person and all that kind of stuff, and how to advocate for myself. But there are places in this world where I'm not comfortable. I had an issue with my car and I don't have a level of comfort when trying to get my car fixed, for example. I don't know how. I'm not familiar with that world. I'm not a car person and it's very intimidating. And it opened my eyes to what it must be like for so many people who encounter the healthcare system, what they must deal with when trying to deal with financial issues from healthcare providers, from drug manufacturers, from local pharmacies.
And I feel like you just nailed it there at the end. There's so many stakeholders in healthcare too. You just said the doctor's office, the pharmacy, there's the hospital, the health insurance. There's so many things. Sometimes you don't even know who to call first or where to go. And
Right.
they're all telling you different things. It's so challenging.
It's very challenging. It's very challenging. But to bring it around, I think that our role in the healthcare ecosystem, if you will, is to ensure that patients have the voice and that the patient voice is not forgotten. Ultimately, all of this entire ecosystem is built around serving patients, whether it's a hospital, a pharmacy, or a health insurance provider, Medicare, Medicaid. They're all there because of the patient. And we as patient advocates have to make sure that the patient voice is heard and is felt by policymakers.
100%. And for our listeners, if you're curious about how you can get involved and share your voice, Corey in the last episode gave a really good breakdown of what states are active and with what medications and how to share your story. But the ultimate point he made was that whether you're currently on the drug or have been on it, it's really important just to share your story and your experience. It's really like true to you, and it's not like some complicated policy thing you have to learn. You just have to share your experience.
Yeah, wow. Well said by Corey. Yeah. And that includes for these prescription drug advisory boards. When they arise, we want to make sure our voice is heard. And we at GHLF will send out alerts to our list, if you're on our list, about upcoming board meetings and ways to get involved and make sure that the patient voice gets heard in terms of your medications that you may be taking and the importance of retaining access to such medications.
Well, on that note, Steven, that brings us to the close of our show. Tell us one thing you learned about PDABs today.
Well, I guess the big thing is how prevalent they are becoming in 2024. It seems to be sort of the issue du jour at the state level, and it's something that we will continue to watch and continue to insert our voice, and dare I say, continue to need help from our patient advocates to inserting your voice.
And I learned that it's really different states and federally and between the states as well. So it's important to keep an eye out for what each of them are putting out.
Well, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
And if you have any questions, comments, episode topics, just want to say hi to us, email us at podcast@ghlf.org. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating, write a review, and hit that subscribe button. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.